What's up, guys? It's your favorite vice president here, Parker. I just wanted to introduce you to our new fellow that we interviewed, Dr. Paim. I'm super excited to do this. We helped fund this fellow with the Arthritis Foundation for Shands UF Health Hospital. This is a long form interview that we did, so it's kind of like a podcast. So feel free to either come back to it later. Sometimes YouTube will save your place so you can come back to it, or if you'd rather, you can just listen to it, just the audio, and not watch the video. So please do enjoy. Thank you very much for watching. Hey everybody, my name's Parker. Welcome back to our Purple Playas Foundation YouTube page. We're going to do an interview today with Dr. Paim. She is our new fellow that we have helped fundraise with the Arthritis Foundation here at UF Health Shands Hospital. We'll get started with the interview. First question that I have for you is, why did you decide to become a fellowship for pediatric rheumatology?
Okay. When I started pediatrics and I knew I had to be a pediatrician, I didn't know exactly what specialty I was going to follow. But then in a meeting, a scientific meeting, I saw a lecture of a pediatric rheumatologist from Southeast Brazil. I'm from Brazil. And she talked about the differential diagnosis of arthritis. And then she went through infectology, she went through cardiology, she went through rheumatology, and then and orthopedics. And then I said, oh my gosh, she needs to understand a little bit of everything. So this is a very good clinician. Okay, I want to do this. So yes, the fact that pediatric rheumatology enroll a lot of other specialties, and we need to understand a little bit of everything to do our differential, was the thing that most catch me, I think.
That's awesome, and we know that very well. I mean, living with our lives, because we have to see so many different specialists and everything, so we really appreciate that, and we definitely understand. So thank you for enrolling in this field like you did, because we got a critical shortage, and having more doctors is always a great thing, so we love that. How long have you been practicing medicine?
Okay, I've been graduated in medicine for more than 20 years now, and I did all my training in pediatrics and pediatric rheumatology in Brazil. I finished a master and a PhD recently, the master many years ago, and now I'm here redoing some of my training here.
Okay, so you have to redo a lot of it because it's different in the US, or?
No, it's mainly, it's not really different. Culturally, people are different. There are some differences, yes, and it has been very interesting and very, it's a learning process. The fellowship has been very important for that. But in terms of medicine-wise, no, it's not so different.
Okay.
And yes, I have to redo not only my specialty but also pediatrics.
Okay. What is your favorite thing about being in pediatric rheumatology?
Well, I'm dealing with kids. Sorry, I'm dealing with children, and I have all the clinical, thought process. So for me, it's the perfect combination.
Yeah.
and I really love what I'm doing. I have been doing it for more than 15 years now. Like, yeah.
Well, it's like that saying, you know, if you love what you do, you never work a day in your life. So
Sorry?
it's like the saying, if you love what you do, then you never work a day in your life because you're having fun with what you're doing.
Yes, yes, yes. It's not something that we say, ah, I don't want to come back. No, you kind of get a little bit addicted. Every day you want new things, and you get very anxious to get the answers, and you want to dig every day a little bit more. So yes.
Yeah. What does receiving this fellowship mean for you and your future?
Oh, it was really, how can I say, amazing. I never expected, and all these experiences has been very good and very open-minded for me. So yes, I think in terms of future, it's gonna help me a lot to get where I need, which is practicing pediatric rheumatology here. And
That's awesome. Well, what brought you here to UF Shands Health?
oh, specifically to Shands, well, my pathway was a little bit different. You know, I came strict for the fellowship instead of doing pediatrics first. So my husband sent my curriculum to some places, and they called me here. And then I saw Dr. Elder and Dr. Tatayaticom doing rheumatology and immunology, which was a field that I didn't have a lot of contact. Then I saw Dr. Tatayaticom and Dr. Wono doing ultrasound and ultrasound guided joint injection, which also was a very good opportunity to learn and to see more things. Then I saw the way they interact and they discuss the cases, the difficult cases, and I saw a very good hospital with a very good structure of pediatric structure, like radiologies with radiology round, pathology where we can reach at any time. We can do Zoom meetings. With this pandemic now, it's crazy, but even in the Zoom we are able to see the pieces and get explanation of everything. We have good approach with adult rheumatology. We have access to their grand rounds, and our ward is with Hemong, which also give us a very straight relation with them, and we are able to just not only discuss cases but also listen to their approach. And so I think all the specialty here, they talk very well, and this is very important when you work, because being a specialty, it's not the whole thing when you are alone. Do you understand? So a specialist alone is not able to do so much things, but when you have a whole structure around you, it makes everything very much easy, and things really go through. So sometimes we receive patients and we think, oh, this is not rheumatologic. It's more leaning toward malignancy. So let's admit the patient, let's call him on, let's do whatever we need to do, and then, oh yes, everything is done, and the patient has the best care possible. So this was also one of the reasons why I came here.
Yeah.
You know, to have access to better treatments and to see things really working better.
And that communication is huge too, because I remember when I first came here, I was just seeing Dr. Elder, and all my other doctors were still in Tampa. So it was a lot to do communication over like that 2 hour distance, and then slowly over time, I transferred GI up here, urology up here, neurology, and now the majority of my doctors are all up here, and it's crazy how much that makes a difference because
yes.
they all use Epic, they're all in the same system. Everything is right there. If they need to talk to each other, they're all either in the same building or literally just like a couple minutes to walk and on
or
the phone.
Call, yeah.
And
yeah.
they all communicate right with each other, and it makes a huge difference that way.
Yes.
So, well, it's a little bit more inconvenient for us because it's 2 hours away. We just schedule all the appointments within a week of each other, come up, stay a week, do all my appointments at once, and knock it all out. But yeah, it really does make a huge difference to have all of the doctors together.
It does. And sometimes the patients, sometimes they don't understand, but it's like we refer to the persons that we know and we trust, because we want our patients to have the best care. So when we ask them to come to our MSK radiology, it's because we trust them. It's because we know they have all the background they need to do the best with their imaging. And when we ask them to come to our GI people or to our hem-onc people, or you know, it's because we know them. It's difficult to refer a patient, refer, and then you go, but you don't know what is the background of, and if they are going to the right person. Or when we ask for an ophthalmologist, we have to say, oh, please go to an MD, you know, because they have the way, they know how to do everything the right way. But still, it's different when they say, okay, tell me, where do you want me to go? And then we tell them exactly, you know, the persons or the place, because there we know that everything's going to be really thorough, and it's what we want is the best care always.
Yeah. That's why whenever I'm getting a referral from a doctor, I always ask, who do you prefer first? And I always ask because I know there's always, if I ask who they prefer, there's always going to be a connection there, that they already know the other person, so I don't have to worry about communication there. So it's important.
Yes,
it's important to have that communication between doctors is very important.
Yeah, and you know, I have to tell you a small history, if I can. My father had a stroke, and he needed surgery, brain surgery, and he went to a very good hospital. And at that time, I remember my main worry was to get everybody in that hospital involved with him. So neurology, neurosurgery, cardiology, pulmonology, ID, GI, everything I could, I got in the same hospital, because that way, every time he was admitted for anything, I would have access to their doctor, to his doctor quickly, and they were having access to everything that happened with him. And this made a huge difference for us, even when his time arrived. Yes.
Makes sense. What has brought you the most joy in working with children?
We get really, really satisfied when we see someone that comes very ill, and 3, 4, 6 months after is completely clinically well, you know, and then they are able to have normal life, or as near as possible of the normal life, this really makes everything make sense for us.
Yeah.
Do you understand?
I know exactly.
So yeah. So it's not really, oh, see the patient, the connections, the clinical, prescribe the medication. No, we want to see, if it's a small one, very small, we want to see their perfect grow and no difference between limbs, no complications. It's what we aim all the time. It's not always possible, but it is what we want. So it's why the first time when they come, as soon as they have the diagnosis, it's so important and so demanding for us and for them, because there's a lot of information. And something that very important in all rheumatologic diseases is how important is to have a very good and quick diagnosis, and how important it is to have a very good and reliable compliance with the treatment. Because with no compliance, you don't go very well in general. And this brings more complications, and this brings more deformities, more problems overall. So when you're dealing with children, this is even more complicated, because at first they are not aware about what is going on, but with time they kind of get, oh, why is this happening? Why me? Yeah. This is the main, why me? You know, and we cannot answer why me, but we know when they come here, I personally feel they are very lucky. You know, this is a great hospital, you have insurance, you have parents around you to give you support, you have your doctor, and you have access to the medication. So let's do the right thing. Let's treat. Yeah. Because the kids, they want someone to put them up. They don't need someone to say, oh, you're sick, oh, you're not able to do that thing. No, they are able to do, you are able to do whatever you want, whatever you dream, because it's a matter of internal decision, and also we need to teach them that also, you know. So yes, what makes me happy is to make them aware about all the possibilities they have in life, and seeing them getting them, you know. Yeah. Reaching their dreams and doing university, doing a master degree. I have patients in Brazil who has lupus, and now they have a master degree, and she is actually working with lupus patients now and teaching them how to eat better, because she's a nutritionist. So I'm very proud of her. Or lupus patient that had 2-3 miscarriage, and we sat down, okay, let's wait a little bit, let's do your treatment, and now she's with her boy in her arms, because she wanted so much to have a kid, despite she was very young, but she wanted that more than anything. So okay, let's breathe, let's treat, let's put everything in the place, and then we can try again. So this makes all the difference for us.
I get that, and I get it's important for doctors to kind of lift you up, lift your spirits and stuff. One of my fondest memories was, one of my doctors is I was in the hospital on a St. Patrick's Day, and we had tickets to go see one of my favorite bands in concert, Young the Giant and Group Love, and I was so excited to go see them, and I was in the hospital that day. The concert was that night, and I'd been in the hospital for a full week at that point, and we thought, there's no way I'm going to get to see this concert. And my doctor came in, and he was like, you know what, you really want to see that concert? I'm just going to discharge you today. There's no reason you can't go see that concert. So even though I still wasn't doing very good, he discharged me, let me go home. We saw the concert. I got home probably an hour before the concert started, literally changed, drove to the concert. We saw the concert, got to meet the band backstage after the concert, got their autographs, got a picture with them, and then I'm pretty sure, was it the next day that we ended up coming back to the hospital because I ended up being so tired afterwards. But it just showed that, like, he was so, like, inspired by me wanting to go to the concert that he was like, you can do it. Like, there's no reason you can't. So,
Yes.
and it's one of my fondest memories of one of my doctors, like, believing in me. So, yeah, it's important.
Yes, it is. It is very important.
Have you ever had a moment in clinic where a child made you laugh? And if so,
yes.
would you mind sharing?
All the time. All the time. They have amazing perspective of everything. They think a little bit different. They are more free and they talk whatever they think. So so yes, like back there in Brazil, I received a patient with some limitation in his fingers. He had 3 years of I never forget that, 3 years of disease already, and it took him many, all this time to come to us. And then I was worried about his ability to write.
Yeah.
So I sent him to a friend, a very good orthopedic doctor, and he was specialist in hand, and he told me once a month he would see patients that could not pay in his private practice. So I sent this patient for him, and I said, okay, I don't want you to do anything right now. I'm starting his medication, but I want to establish care, because if we need anything, you will be there. And the boy, he identified himself so much with this doctor that even after that medication, he improved a lot. He never needed any surgery, anything, but he kept going there. And the guy also, connected with the boy. And I did everything. I did all the work. I gave him the medication. I treat him, but he told me, oh yes, I want to grow up. I want to be a doctor. I want to be an orthopedics, and I want to change my name to the doctor's name. And I said, this is not fair. You should call Luciano and not, whatever his name was. I remember his name. I just don't want to Tarcísio. But it was very amusing because he identifies himself so much with the guy.
Yeah.
That he wanted to be him.
Yeah.
Even the name he wanted to change. So
That's
what
funny.
can I do?
That's cute.
Oh, it was amazing. He was so happy. I treated him until more than 20, I think. Now he's a big boy. And here also we had a little one, 2-year-old, and I asked her to make part of my project. She was so excited. She was so happy that she saw her mom signing the consent, and she said, I want to sign it too. We just need to ask assent for over 7-year-old, but whatever, she wanted.
Yeah.
So I let her sign, and she was so happy.
It's so cute.
Yeah, it is.
So we'd like to get to know a little bit more about you. So do you mind if we ask some non-rheumatological questions?
No, not at all.
Okay. Where did you grow up?
I'm from Brazil. I'm from Northeast Brazil, which is a very hot and beautiful place full of, very good food and a very rich culture, a lot of beaches. It's amazing there. And the name is Salvador, and Bahia is the place.
Okay. Do you have a personal hero or someone you look up to?
My father,
And why?
always. My father, he always was my hero because he was my my sorry, the model of a person that I always wanted to be. He was very strict. He was he worked very hard.
Yeah.
He was completely passionate about his work, and he talked about that with everybody. He had an amazing cultural, you know, knowledge. He knew a lot of places. He always traveled a lot, and he liked to know the history of every places, to have an idea. Even my friends, doctors, when he used to go to the consults before the stroke, he would give them tips on where to go, where to visit, you know, and everybody would stay 1 hour with him because everybody wanted to listen his history, his histories and his experiences and everything he had to tell them. So he was a very good person, and I miss him a lot. Yeah.
Sounds like a wonderful guy.
Yeah, he was. And I said, no. She said, you're just like your father. And I said, is this a compliment or are you complaining about me? And she said, no, it's a compliment. So yes.
Okay. What do you like to do in your free time, like hobby-wise?
Oh, we like to go to spring here in Gainesville. We like to go to the springs. We like to go to Depot Park, biking. I like to bake. We like to be with our friends all the time, a lot. So now with the pandemic, we can't have a lot of friends around, but we always have, you know, one family around, and yeah, it's mostly that, and be with my family, which is my friends. Well, you know, my best friends now, my husband and my daughter.
If you like biking, you should talk to Logan. Logan bikes all the time.
Oh yes, we know.
Loves biking.
Yeah.
Yeah. So what is your hope for children with rheumatic diseases?
I think we improved a lot lately with all the new target medications we have. Their lives are way better than 20 years ago. I used to tell them that we don't see the deformities that we used to see anymore. We don't see a lot of, you know, bad things so much, unless on those ones that don't follow the treatment. But my hope is that they would not need to drive more than 2 hours to get to a rheumatologist.
Yeah.
Or they would have access to the medication, the right medication, on time, without so much, you know, there are a lot of bureaucracy, you know, a lot of papers, a lot of things to fill, and it's not up to us mainly.
A lot of insurance issues and
Yeah,
stuff.
a lot. And also in terms of research, I think in the future we will have more answers to our question: what is causing, what is the best way to treat each patient with their whole complexity, because in rheumatology my older chief used to say, every patient is a different patient, so we have our consensus, but we need to have a specific treatment for every different patients, because they definitely don't follow the same pathway.
Yeah.
So yeah.
What's the Arthritis Foundation's and Purple Playas Fellowship Award mean for you?
Oh, I just have to thank all the time. I thank every day for that, because I think I was very impressed with your work and the Arthritis Foundation work. It's really amazing what you've been doing here. The level of organization, the level of care, and the way you give the patients or the new patients the informations, and the way you make them, support them, it's really really great. I don't have any other word. It's really amazing. When you come from other places, you have this idea better, because we have small and isolated, attitudes to give our patients more support, but they can't, or they are not allowed, or they don't have the support of the institutions too, so they cannot reach so much patients as you reach. They cannot help so much patients as you help. So it's really a great work, and we just need to thank you for all this.
Well, I appreciate that. Our goal is, honestly, we just are trying to do what we wish we had when we first got diagnosed. That was our goal at the beginning, because this is all stuff that we thought, man, when we first started, if we had this, it would be extremely helpful to us, and that's how we started it all. So, and we hope that that's how people feel that are getting like these kits and these little things that we're giving out. So, and that's kind of been the feedback we're getting, so we hope we're doing a good job.
Yes, definitely. I can tell you yes. And we
Appreciate
always
that.
ask them to reach you guys, and to take doubts with, because sometimes there are things that they don't want to ask us. They need someone else that lived the same situation to tell them. So it's really a differential.
Some of my favorite moments of the day are when I get pictures of people that send me a little picture of their kid holding a purple puff stuffed animal, and it's the little things, because I created that. I made that when I was like 10 years old. I drew a little picture of a purple puff, and then 10 years later or 9 years later it became a stuffed animal, and now I'm seeing little kids walking around in the hospital with it, and
Yeah, they love it.
it makes me really happy when I get pictures sent of people sending me their kids hold it. So
explain to her why it's the purple puff, because she may not know.
Oh, have you heard the story?
Mm-mm.
So when I was in middle school, it was originally elementary school. I was on a lot of steroids. As you know, they do that a lot. But my first rheumatologist did not believe in biologics, so he kept putting me on steroids, and at one point I was on 120 milligrams a day, and that lasted for, almost a full year, right? Yeah. So it was really bad. I gained a lot of weight. I went from being about 60 pounds to 130 pounds-ish. So pretty much doubled my weight, and in elementary school they called me idiot arthritis boy, because I was diagnosed with idiopathic arthritis. So that was a really hard time. I went from having a lot of friends to having one friend. He was the only one who stuck with me. because they didn't want to catch my idiot arthritis-ness because it was contagious. That was the,
Oh my gosh.
yeah, kids are mean. And then in middle school it went on and I had to start using my wheelchair, and everybody said the only reason I was using a wheelchair was because I was fat. So that was rough. So I went through a lot of bullying throughout 5th and 6th grade, and that was rough. But the way I kind of started coping with it is I made our little purple puff guy for my walk team, and his motto is "I'm not fat, I'm puffy." So it's kind of, he was like my little thing, and after that I decided, you know, I'm just not gonna deal with people making fun of me, and I'll just start laughing it off. So I kind of just, my whole lifestyle changed, and I didn't let what people say hurt me, and I'm just gonna start laughing it off. And I just became positive. I just looked at everything in a positive outlook, and I just started laughing, and that became my new lifestyle. So I just don't really care what people say about me anymore. I don't care what I look like. It is what it is, and that's how everything kind of changed for me. So, but that's why I like it when I see little kids holding their little puffs, because it reminds me of my kind of change into who I am today. And I hope those little kids who also have to deal with all this steroids, and probably some of them are going through bullying as well, it can maybe give them confidence and stuff to deal with what they're going through.
Yeah. A lot of time this is a very big concerning for us too, is how they're gonna deal with all these changes. Sometimes you cannot avoid the steroids. They are really necessary, despite we are trying to, you know, deal with that a little bit better right now. But yes, there are ways to make them understand things and try to make them overcome all this. And it's really, I think, coming from you, it is much powerful, do you know?
Yeah.
Because this experience that you had can really make all the difference for the others. And perhaps renewing this history everyone, how can I say, time to time.
Yeah.
You know, and keep telling them the history and how you overcame that. It is very powerful, believe me.
Yeah.
Especially the way you talk.
I've been told I'm good at talking, so it's one of the few things I'm good at. I've always been a good public speaker. It's one of the things I enjoy doing, so.
But don't say one of the few things. I don't think it's the few. You've done so much already. And you do a lot, you know? So it's not a one.
People give me a lot of credit for things that I don't do. I'm really just the face. She, over here, does a lot.
She does because of you.
Yeah.
And she does with your consent.
Yeah.
And with your help.
People don't realize how much that she does, though. That's the thing. They give me credit for a lot of her work.
But you are aware about everything.
Yeah.
So I know she does because you are beside her.
Yeah.
Do you understand me?
Oh, yeah.
So yes, it has, for sure, it has to do a lot of about her, but also about you.
Yeah.
Yeah.
I guess
Don't say few.
I guess I'm not someone who has a lot of self-confidence.
Oh, okay, so if you have this if you recognize this, now it's time to work on this.
Yeah.
Because I don't see you in a wheelchair anymore.
No?
I'm seeing you with a very good range of motion of your hips and knees. You know?
Yeah.
A lot of people cannot do this movement you're doing.
Oh,
And
yeah. Things have gotten a lot better over the years.
Yes. So, my friend, get it back.
He's
Get
on
it
the
back.
upswing. He's on the upswing.
Yeah.
He's always had it in him.
You're getting ready. I've seen pictures from you, and I was very impressed when I see you today.
Oh, yeah. There's some pictures of me that are real bad out there.
You're different now.
Yeah.
You're growing.
I've lost like 60 pounds in the past year. But
And you're feeling better.
yeah.
And stronger.
Well, right now I have like no muscle, but that's because I haven't really left the house in a year. But I'm going
you
back
can do
to
things at house.
I'm going
it's
back
not an
to
excuse.
I'm going back to physical therapy right now twice a week, so I'm getting all that back.
But you can do it at home too.
Yeah.
Instead of twice, you can do 4 times a week.
Yeah.
Twice in the physiotherapy and twice at home.
I have the equipment at home.
I'm the no excuse, you know.
I have the
girl.
equipment at home. I just am not doing it because I'm lazy.
I know it's not easy.
Yeah.
Believe me.
It's
know.
motivation that I don't have.
Mm-hmm.
And that's why I'm seeing psychiatry right now, because of that. So.
Yeah, see? You're ready.
He's already making
You're
steps.
ready to go.
Okay.
You didn't know she was going to interview you.
For real. Is there anything else you'd like to share? Or anything you want to ask us about?
Well, what I need to share is just that I'm here, and really, whatever you need me, I'm glad to help with anything. I know I'm just a fellow, but
You're not just a fellow.
you know.
You're part of the Purple Playas family now.
Thank you. But I'll be glad to help, as I used to help there too, and I feel very, it's part of my, my duty, because it's not, for me to be a doctor is not diagnose and treat, I need to explain, I need to understand, I need to read in between the lines, and I need to make my patients stronger. So whatever you want and think I can help, I will be glad to do it. I'm doing whatever I can now. I'm doing research here with the juvenile idiopathic arthritis. I'm also part of the Diversity, Equity, and Inclusion Committee of the Pediatric Department as the fellow representative. I'm doing satellite clinic, telemedicine course. I'm trying to, open my mind and learn as much as possible. And I hope to be, not sure if soon, but I hope to be a good rheumatologist here.
It's awesome. Well, we're happy to have you. Thank you so much.
Thank you. Thank you, guys.